Our next session is Taking a Flexible Approach to the Total Workforce. Please welcome to the stage our speakers and session chair, Dean Royals, former president of HPMA.
Welcome everyone, and thank you for coming to this session on taking a holistic approach to the entire workforce. My name is Dean Royals. I'm the past president of the HPMA. Working independently, I'm chairing this session here today. Now, I can't think of a more important time when the workforce as a whole has been so crucial to what we do in the NHS, and in particular, that flexible workforce. I can remember a time when we used to look at the use of bank and agency as a sort of distress purchase. It was something we did when we couldn't get substantive staff. But increasingly, we know that those staff that work on the bank and agency are a crucial part of the workforce. And one of the questions is, do we value them enough? NHS professionals who work with the NHS have got 45,000 people that work on the bank that are bank only. The way that the workforce works is changing, and we've got to respond to that. That contingent workforce has never been more important. We know from an agency's perspective that most of you here will be looking to reduce those costs, and how we use that bank and flexible workforce more effectively is ever more important to what we do. So let me introduce our panel to us today. Paul, would you like to introduce yourself?
Hi everyone, Paul Renshaw, I'm the Workforce Director for NHS Devon.
Nicola?
Nicola McQueen, I'm the Chief Exec of NHS Professionals.
And Karen?
Good afternoon, I'm Karen Bond, I'm the Chief Nurse of Buckinghamshire Healthcare.
Thank you, and thanks to the panel. This session will be being written up and will be available on the NHS Professionals website. Towards the end of the session, we've got an opportunity for questions or observations, so there is a Slido that will be available for that to use in the usual way. But Paul, just getting us underway, so given the importance of the flexible workforce, what are you doing in Devon to ensure that you get effective utilisation of that workforce?
Yeah, thanks, Dean. I think the short answer is quite a bit, but not enough. So we've just published our Devon-wide workforce strategy for health and social care, and flexible working sits in the heart of that. I think to your point earlier, it's often been seen as a grudge purchase, and if people ask for flexible working opportunities, it's sometimes seen by some people as having, showing a lack of ambition, and we have to change that mantra completely. Two reasons, first of all, well, actually three reasons. First of all, the younger generation are demanding and expecting a more flexible sort of way of working. I think us that are going to have to work a lot longer probably will need a more flexible way of working. And certainly from a Devon perspective, and I suspect we're the same as everybody, we will need greater workforce flexibility to deliver the services that we need to get delivered. So there's three things at play there. We've done a reasonable amount so far within Devon. We've had a medical collaborative bank running for about 2 years now. We are working with a certain NHS-owned provider of bank solutions that I can't name. No, I can name, NHSP. So by the end of the financial year, we will have got all of our nursing bank into one place, run by NHS professionals. And we've got big ambitions for that, particularly around reducing agency spend. We're just piloting at the moment some self-rostering. And I know there's some good examples out there of self-rostering, but again, a lot of people are quite fearful of that. But there's a lot of evidence around it, helping retention, reducing absenteeism, and actually filling shifts more appropriately. I think the final thing is that we're just starting to discuss with partners how we can get to a position where portfolio careers are far more accepted. As we're all working longer, I think we have to find imaginative ways of people changing what they do, but not completely, as they get older and work longer.
That's great, thank you, Paul. Just by way of a show of hands, does that resonate with people in terms of looking at that workforce differently? So if you kind of agree, are you all sort of looking at that? People trying to do things, again, show of hands, sort of across systems to make better use of that workforce? Yeah, so got some stuff going on there. Thank you for that. Nicola, as Chief Executive of NHS Professionals and working as part of the NHS family, how can we make sure that the evolving workforce works for everyone at all stages of their careers?
Yeah, I think it's a great point. I think my first point was going to really touch on what Paul just said there about changing the narrative and recognising this flexible workforce. And I think that would go a long way to doing a whole bunch of things. So I'll just give you an example. Over the last few years, the NHS Professionals Bank has grown so significantly, but the biggest area of growth has been in those that we call career flexible workers. So they're not working substantively anywhere else in the NHS, but still are doing 30, 40, 50 hours a week in, week out. So they have chosen this way of working. Yet we perhaps don't recognise them in that way. We think of it as top-up and the traditional bank that would pretty much be there to facilitate overtime and additional shifts for substantive staff. And that is absolutely not the case today. So firstly, we need to recognise how that workforce has evolved and grown so significantly. There's 100,000 FTE, if you extrapolate out the banks across the NHS, that we aren't catering to specifically. And I think there's some brilliant examples across the system where they're starting to think of one workforce. But very deliberately, I think we need to start thinking about bank as being something that's different to agency. And we very often group bank and agency and not substantive and bank. And that will make such a difference to the sense of belonging and the retention that we see through this workforce. And I think that then plays into that sort of all ends of their career, because if we look at the behaviours and the personas across our bank, we have lots and lots of people that are still early career but just opting to work flexibly. And they have got one way of wanting to retain training, still have career enhancement and career paths available to them. We've got people that are coming in perhaps at the back end of their careers or in the middle of their careers where they're doing multiple things, perhaps caring for their own families and things, or just wanting to work less hours in one particular trust and actually getting some variety. So we see a whole bunch of behaviours, yet we don't see enough of the ways of working that accommodates that so formally. So training was going to be my next point, because NHS Professionals have got a training academy now. We're probably one of the biggest trainers of clinicians across the NHS. But we don't give that access throughout their whole career life cycle, and we need to. We tend to treat it as the upfront training to come into bank, and then the mandatory and statutory training that we're all adhering to. But actually, if we can start thinking about this being a workforce that has got a career path and a plan and can fill some of these really significant gaps that we've got in the workforce, we've got to give them access to training throughout their entire time on our banks. And then I guess my third point is just making sure that we are listening to them and they've got a voice. So we spend a lot of time with the surveys and the bank surveys, and there's a few things that they absolutely desperately want from us, which is access to training and a sense of belonging, which we've talked about. But very interestingly, they very rarely talk about pay, and this isn't a more expensive way of us procuring workforce through the banks. But they do look for us to support them with longer term lines of work. So this idea of where we're seeing some of this self-rostering needs to come into play to this bank workforce, because we will get much more utilisation from them if we allow them to book into shifts, months ahead. And I think we need to make that part of our workforce plans as we move forward.
Thanks very much, Nicola. And again, just by show of hands, given the things that Nicola's been saying there about supporting this workforce, does anyone think that they're doing enough? If you think you're doing enough about supporting that flexible workforce, a show of hands. So no one's hand up at that at the moment. So interesting. So Karen, as a chief nurse, how do we help people who are working flexibly to feel like they belong? How are leaders working to enhance that sort of inclusion and belonging through their approach to leadership?
Yeah, thank you for the question. Yeah, interesting that nobody put their hands up. So there's clearly lots of work to be done here. I think we need to make our flexible workforce feel that they are part of the organisation. And I think it goes back to your points about feeling that they're a top-up and not necessarily part of that overarching resource that we really much need. And I think we can't get away from the fact we will always need to have a flexible temporary workforce. So one things in my organisation we're looking at is how do we also include them in, celebrating them as we do our other staff, awards, the excellence, all of those things. They tend not to get nominated for those things. And we had a really great example when I had a Care Quality Commission inspection a few weeks ago with a temporary nurse that they actually flagged up as really good practice, and she'd been working temporary with us in our A&E. I think the bit about us as leaders, and many of you in this room will be leaders, and those of you that lead teams, it's really important that we think about the intention of which we feel we include individuals. And we talk a lot, and the previous session talked about workforce rate equality and how people are feeling, and many of the people that work flexibly on temporary staffing do come from a diverse background. I think we have to acknowledge that in this room, and they're choosing to work flexibly for lots of reasons. So it's really important that we start to think about how we are inclusive. We talk about it a lot, but are we truly living the values of that? So looking around the room, thinking about who's in the room, who you're listening to, how you're listening with intention. If you're seeing everybody it looks like you in a room, are you actually acknowledging that and thinking about, are you hearing from the right people? Being compassionate, and we talk a bit about compassion. There's lots of work, King's Fund and Michael West, but it's also about alleviating people's distress rather than just empathising with them, and there's a lot for us to do in that space. I think the third thing I'd also talk about is a sense of belonging, because I think we have a duty to create a sense of belonging for individuals, and that doesn't mean, and that's the complete opposite to how people feel that they have to fit in. How do we allow people to bring their true selves? How do we enable them to feel that they are part of something that they can bring themselves to? And that does take leadership. It takes real commitment, and it also takes for many people to also reflect on how they are creating that sense of belonging and enabling people to feel that sense. And I think particularly with our temporary workforce, I think that we need to value them in that way as well.
Yeah, thanks very much, Karen. And I saw you both nodding along there. But Paul, that sort of sense of 45,000 people that are just doing bank, that different stages of their careers, early entry careers, is that just the nature of the work that's changing, or is there something to do about the nature of the workplace? What's your sense about why increasingly people are wanting just to have this flexible approach to their work?
I think part of it is to do with the fact that people are going to have to work longer. I mean, I've got sort of teenage children, and I say to them, you'll have probably many careers in your working life rather than just one. But I think also it's the demands of the service. We won't be able to staff Devon, for example, by doing what we've always done, because we either can't find the people and/or we can't afford them. So having a more flexible approach and enabling people to work around what is a very big county, is something that we need to happen, because we can't carry on doing what we're doing. And the other thing I was going to say was that we're looking more at how we can create better flexibility between health and social care. Yeah. And that's the other big part of the equation that we don't pay enough attention to. But I think there's a combination of it's people's expectations now, and if we're not offering it, somebody else will, and also just the nature of the service. We're going to need that flexibility of people being able to work here, there, and everywhere, and we need to work more, certainly within Devon, on things like IT systems, so it's dead easy to work in one hospital one day and then another hospital the other. We haven't got that bit quite cracked yet. Yeah,
and Karen, you talked about that sort of sense of belonging as well, and sort of feel included. Now, it's just, as you was talking, I was thinking, as a former HR director, you kind of go on your organisational values, don't you? So you want people to belong to the organisation, but increasingly, we're wanting people, as Paul was saying, to work across the system, to work in social care. What can we do about, feeling that you're part of a system, which is maybe feels a bit different to being part of an organisation? Any thoughts that you've got on that?
Yeah, I think that will be a thing for us to focus on, because there is something about people feeling they belong to a ward, a department, and the bigger thing about an organisation. And then many of us, as a nurse, I feel a real sense of belonging for being part of my profession. So creating that sort of sense of belonging as part of a system is really important in thinking about placing value on the individuals rather than just the place that they're working, and that they and that we're really it's really important that we celebrate them. And I think that you know, always feeling that actually wherever you work, you'll be accepted, you'll be received well, you'll be orientated well, and you'll be valued for what your contribution is, I think is really important. And I think we really need to think about that more as people are going to be more flexibly working across systems and creating that sense of belonging to much more of bigger than just the organisation for which you work in. And that is going to take a lot of commitment from all leaders, actually, of how we do that, and also listening to individuals that aren't working flexibly. What do they feel they need to help them? Because I think often as leaders, we're making the judgments, we're not asking the people. And it goes back to flexible working. We've been I've been in the NHS for 30 years, been at this for a long time. We're clearly not doing very well. If nobody put their hands up earlier, there's still much work for us to do. So, you know, is it that we're asking the right questions or listening to the right people? And I think you're right, generationally now people will have multiple jobs. I moved around quite a lot when I was a junior nurse. I loved it, but I had to keep applying and reapplying. So actually making it easier for people will help them to feel that sense of belonging, to move through systems and get their choices accepted for their choices rather than seeing as a hindrance.
So, yeah.
That's the bit that I think makes it a lot worse, that people feel that they're being a bother if they're working temporary or having to move around. Actually, we should be embracing it.
Yes. And it's interesting, isn't it, how that nature of work has changed over the last generation. Certainly when I started work, people saying, you know, plan to retire at 50, you know, that's what you'll be doing. And now, in my lifetime, that's gone from you'll need to work till 70. Yeah. And, you know, so it changes rapidly, doesn't it?
It does.
But Nicola, just thinking on that that sort of sense of belonging and sort of collaborative banks, I mean, the prize here for us, isn't it, is if we can get this right, we can move the staff to where the patients are, yeah, rather than, which we still do too frequently, move the patients to where staff are. So every time we have a divert, every time we move people from one unit to another, it's because we've got the staff in the wrong place, really, isn't it? Yeah. So what, in terms of that collaborative bank, what's the successes that people can look for in terms of working well across a system?
Yeah, I think that's a great point, because we saw so much of that collaboration during the pandemic, didn't we? Yet we've sort of come out the other side and not necessarily taken that into our peacetime, if that's what we can call it, 'cause it's not going to be peace, is it? But we haven't taken some of those collaborative ways of working into our time today. And I think flexibility works both ways, doesn't it? So if we give flexibility, we can have flexibility. So we see pockets of really brilliant working on allocate on arrival. So some flexible workers want to go, actually, do you know what? I can be available every single day from 10 till 4. But that's all I'm available for. But you can have as much of that, as many days as you want. Yes, please, thank you. But we don't really know where that's going to fit in our roster. So we'll allocate on arrival. So on the day, you can start moving these resources around to where the need is greatest. And that in pocket works so well in some of the systems. And that's part of the collaborative bank nature, that we can start saying, well, actually, do you know what? We always need last minute demand of this many nurses with this many doctors and so on. And let's just therefore allow people to book into those shifts for as long as they want to, and we'll allocate them on arrival. And that allows us to move people across systems. And we saw that working really well during the pandemic. The other thing that we saw working really well flexibly across systems during the pandemic is where we brought people back into the NHS, but actually they wanted to give us sort of 4 days a week, but they only really wanted to work frontline for a couple of days a week. And then they were happy to do virtual ward work or test and trace as it was then. And giving that variety of work, because actually you might just not want to be frontline 5 days a week, but you're quite happy to give your time. So giving that nature of flexibility about where they work in the system and what they're involved in, I think has got huge value.
Great, thank you very much. So some food for thought from our panellists there. I think we have got a roving mic. There is if a colleague is at the back, and my Slido's asking me to log in. So if someone wants to have a look at my screen. But anyone got any questions or observations? That someone right over here on the corner, sir.
Hello, thank you very much for sharing your insights. Can I ask you, what is your perspective on automation and robotics filling a lot of the challenges with staff shortages inside of hospitals?
Yeah, so the role of AI and robotics. People talk about nursing being a people profession and they'll always be there, but we sort of see stuff, don't we, that says, you know, with technology that, you know, observations and a lot more can be done that will free up that nursing time. But Paul, do you want to go first start on that?
Yeah, I mean, there's loads of things that we do, particularly in corporate services, that actually, we can and should be having, robotics to do for us to free up time for more resources on frontline care. But I think, things like, some of the sort of wearable technology that's out there now, and there's people displaying it in the exhibition hall outside, where we can get people working remotely in the community, doing things they've never done before, without having the sort of traditional level of training and supervision that they've had to have is going to be really crucial. And I go back to the social care workforce. I think we have to mobilise that workforce in a different way, because they're running out of people's homes 2, 3, 4 times a day. And certainly one of the things we're looking at in Devon is the extent to which we can find ways of saying to the district nursing team, you don't need to go and do that, because actually there's a way of getting social care colleagues trained, but also effectively supervised through technology to give them the confidence to go off and do things that they don't currently do. And I think without doing those sorts of things, it's going to be a real problem for us.
That's great, thank you, Paul. And Karen, people often talk when I listen to radio programmes that robotics will never replace nursing. It's not about replacing, isn't it? But there's certainly elements that can be done through AI, artificial intelligence, those sorts of things that are coming through. What's your sort of sense on the impact on, the way that people work in that way?
Yeah, I think it's well documented, isn't it? There's chronic excessive workloads that many people feel in working across the health service. King's Fund did a great report a couple of years ago, but there's something about how we enable people to work more effectively, and I think that using some of those technologies will definitely help that. And my trust in integrated acute and community, so that bit of working across the different pathways and having agility around doing that is really important. So I think freeing up people's time, because it will be we always will need people. I don't think we're ever going to get away from that. Well, I hope we'll always need people. And I think that, but what we need to do is enable them to have the time for the things that require that personal touch, rather than some of the paperwork that people often are spending a lot of time doing, some of the other things that I think that some of the artificial intelligence can really help. So I think it's something we definitely need to explore more of.
Yeah. Thank you, thanks. And Karen, I'll let you come on to that. They also got a question on Slido that, so someone's talking about the use of the word bank as not a great word, not, is there a different word? And interesting, when I listen to the radio in the day, you often get NHS staff phoning up saying, well, I'm on the bank, and the radio presenter doesn't know what they mean, working in a bank. Any thoughts on a different term for, bank and agency? But I'll let the other two think about that as well, but AI and use of the word bank?
I think I agree. When I came in to look after NHS professionals a few years ago, I didn't know what the word bank was. But I do recognise flexible workers, and career flexible workers is something that we tend to use. And it's really interesting because the Secretary of State came to our stand this morning, and he kind of went bank. And we sort of had to explain him, because it just doesn't resonate anywhere else, does it? So, look, I think there's a number of things that we should think about changing, and that is this kind of use of bank and agency over here, and talk about it as flexible workforce. Yeah. I really do. And I would love to be scheduling robots as well as all of our clinicians around the NHS at some point. But I think it's really important that when we think about AI coming into the workplace and the readiness for it, we've got to think about that as in a training capacity. Are we making our workforce digitally native, so that they're ready for the transition that we're all going to see, and it perhaps needs to be thought about as we start to onboard people. Yeah, and that technology impacting on training and the way that patient records are kept, and the way that we interact with people as well. Is any other questions we got in here? I should say, Nicola mentioned Secretary of State, so there is another session after this, but then they're going to be streaming the Secretary of State speech into this room as well. Sir, at the front here, is there someone? And then we'll take two questions here, I think. So someone in blue, I think, if I can see through the light. So gentleman at the front here. And then we'll take the two questions. If you keep your hand up.
Thanks for calling me a gentleman, Dean. It's Peter Carter speaking. A question for the panel, really, is as a former Trust Chief Exec, I often found there was resistance from first-line and middle-line managers on things like flexible working. And I wondered, first of all, do you agree with that? And if you do agree, what do you think should be done in terms of helping to train and educate and to get the first line and the middle line managers to see the wisdom of flexible working, because I've got no doubt that Paul, Nicola, Karen, at your level, you see it, but it often suffers deep into the organisation.
Yeah, thank you for that, Peter. Let me take the other questions as well, and apologies, Peter, the lights, I didn't recognise you there. Peter, also the former Chief Executive of the RCN.
And following hot on Peter's heels, it's Sarah Gorton here from Unison. So I think one of the things you established early on is that we don't think enough is being done to deliver the contractual commitments that we've worked with employers to put in for substantive staff. So I was just really interested to know, are you starting to see some examples of pathways through from temporary work into substantive, and what more can we do to learn from the temporary workforce about what we can do to embed flexible working amongst the substantive cohorts?
Thank you. And look at that, two trade unions for the price of one. I'm not sure what the collective noun is in a room like this, but Karen, that middle managers valuing people and then also picking something up about what can we learn. What's your thoughts?
Yeah, so thanks for the question, Peter. Yeah, I agree with your sentiments. I mean, I joked earlier about how we've been at this for a while and we're still doing it badly, and I think there is something about how we help people to understand the importance of flexible working, because people, like you say, rather the careers people are choosing now, and we also have to acknowledge some people are choosing to work flexibly because of how they feel about the organisation, how it treats them. So there's something about us recognising that and addressing that as well. I think I always liken the fact that often as managers we sit, and I was ward sister sitting there trying to decide whether I sign off the flexible toolkit or not for somebody. It's like an individual making a decision instead of a collective decision amongst the team. How do you throw that back to the team and say, how do we enable this person to work in this way? Because often what you'll then get is a bit of resentment amongst the rest of the members of a team for somebody working in a slightly different way. And I think that's really important, that we start to shift our focus, and we can only do that by leading by example and changing the way we do things. And we need to get deep into, I think you're right about getting deep into organisation, ward sisters, departments, community teams, to say we need to work at doing this differently, because people will leave and they will choose to go somewhere else, like you say. So really important for us to think about that.
Thank you. And that point about value is where we came in, isn't it? That too often the narrative has been around that sort of distress purchase or something that's not as good as substantive. And yet we know that a lot of these people, that's the way that they work, and they work in the similar organisations a lot of the time. Paul, any thoughts from either of those?
Yeah, I mean, I suspect that when the flexible working request comes in, there's a deep sigh and eyebrows and, one needs to have to handle again. And I think it comes from the top. I mean, I spoke to a chief executive a couple of years ago about flexible working and just posed the question to them, have you thought about it for you? And the response was absolutely not. I have to be here 5 days a week. I couldn't possibly not be here on a Friday. I'm thinking, well, you've got thousands of people to run your hospital for you. And I think it has to come from the top. Otherwise, it's just words and platitudes.
No, agree. And someone's just put on to the slider that one of the reasons that people do flexible working is the way that they choose to control their work. So that, work-life balance, that health and well-being stuff, also people are voting with their feet on that. Nicola, any thoughts?
Yeah, a couple of thoughts, actually. We call it sweat the small stuff. During the pandemic, certainly, people would turn up to a ward and not be greeted particularly well. So we had to go right into the wards and start to train and give awareness to how they were receiving these people that were turning up for the first time. So it is about giving that awareness and that training, and I think we need to do much, much more of that in these ward level management roles. And we saw that, and we saw a real turnaround by people going, okay, oh, brilliant, thank you for coming to help us today. Here's where the toilets are, here's the bathroom, and all of the sweat, the small stuff, and that made a huge amount of difference. But we had to do that through training and awareness. And then to the point on, are we seeing the flexibility of moving bank into substantive roles? And we see it both ways, actually. So a lot of work that we do for care support worker development, as an example, is bringing net new into the NHS, training them through and helping them work flexibly to gain experience. But they very often end up as a substantive member of staff, and we're encouraging them to go that way in. equally, as people are starting to resign and leave, you know, we're like, don't leave yet, join the bank. So we're seeing it work both ways, and I think that's where the magic is in being part of the NHS.
Great, thank you. And we've got about 2 minutes left, so just one sentence each. But what more do you think could be done to support that contingent workforce, that flexible workforce? Karen.
Sense of belonging. They need to belong, they need to feel valued.
Thank you. Nicola?
Agree, and one way to do that is to bank and substantive agency.
Thank you.
I agree. Sorry,
Yeah.
but I think it's how we perceive it.
Yeah, hat trick. There we go.
Yeah.
Sense of belonging and make you feel valued, which I think also speaks to Sarah and Peter's point really there as well. So thank you everyone for coming to this session. We finish at 1:30. Please, there's an evaluation form on Slido. Tell us what you thought of the session. We'll be able to capture that and improve things as we go forward. But thanks very much for coming. And if I could thank the panel in the usual way.